ACL tears are more common in certain athletes, primarily in female athletes. Some studies have shown that there's a 2 to 8 times increase in the number of ACL tears in female athletes compared to their male counterparts. Female athletes involved in gymnastics, basketball, and soccer actually even have a higher risk of having an ACL tear than other sports. There are a lot of theories as to why female athletes have a higher rate of ACL tears. There are a lot of different thoughts behind it, from anatomic differences, hormonal differences, biomechanics. To start with, female athletes, they have found actually have what we call a higher Q angle. It's the angle where the femur meets the lower leg bone. They have a higher angle because of having a wider pelvis, and that actually puts a higher strain on the ACL, particularly when they're cutting and pivoting or landing a jump, which may lead to increased chance of spraining the ACL. Other risk factors we believe are related to the anatomy, that females tend to have a smaller ACL to begin with. There's also a smaller notch that the ACL sits in, and that between the two of them, that makes it easier for them to tear their ACL than their male counterparts. There's been some thoughts that there may be a hormonal component to it. The ACL does have estrogen receptors in it, and that changes in the hormone levels may lead to some laxity of the ACL, which could lead to an ACL tear. Another reason that female athletes have a higher risk for an ACL tear comes down to muscle strength, muscle mass. They tend to have less strength in the hip muscles and the core muscles, which shifts the weight further over the knee and increases the strain potentially on the ACL. The other factor, which I think is a big factor in increased ACL tears, is the biomechanics of the female athlete. They tend to land jumps with their knees and hips extended more, which increases the risk for having an ACL tear. The good news about that is that that's actually something that can be trained, and that you can decrease the risk with appropriate sport training to improve the muscle coordination of the trunk muscles, the hip muscles, increase hamstring strengthening, and part of that is called plyometrics. It's a special type of pre-season training regimen that greatly decreases the risk for having an ACL tear.